Hi, I'm Jade Stricker, and this is
Rachel Hall, and today we're doing an exercise that works the glute medius.
So this exercise is really important to female endurance athletes, especially because the female body has a large hip ratio. This exercise targets the muscle that is involved in stabilization of the pelvis and the hips. So let's get Rachel to lie down on her side. The first thing that's really important is to remind your athlete or your patient that this is a stabilizing exercise, and we want to make sure that the core and the pelvis remains neutral. So first you would have them target their deep core muscles. So one thing that you really want to get engaged is that transverse abdominis. We're going to bend the knees at a 90-degree angle. Ankles are going to remain together. And the knee is just going to come up and hold for 5 seconds and back down. What you want to remember, a common error with this is as the knee comes up, movement in the pelvis or the core. So again, you want to remind the client or the athlete to engage that area of the body. So again, up and down. Variation or adaptation 2, to make it a little bit more difficult, is we're going to bring the knee up and then a heel is going to come off. She's going to squeeze in through that glute medius. Some of the glute minimus will be engaged and back down. For the third variation or adaptation, the leg is extended out. Remember, keep that pelvis or the hip bone, that ASIS, forward. Bring the leg back to about a 20-degree angle, and she's going to come to the starting point and all the way up. Stop, hold for 5 seconds, and then back down. A variation for level 3 of this exercise is right now the femur is neutral in the acetabulum. When we turn or rotate the knee towards the ground, invert the toe or point the toe down towards the ground. Now she's engaging and targeting even a little bit more of that glute medius. So again, starting point, come all the way up, hold for 5 seconds, and back down. Another way to variate this is rotating so the knee is pointing toward. Again, these angles, covering all angles of the joint, you're going to be working the muscle fibers in different directions. And up, 5 seconds, and then back down. Always reminding, keep the core engaged, keep the pelvis engaged. This leg should come back to a 20-degree angle, and you can take the variations where you would like to, where you feel your level is at. Thank you again for listening. Have a great day from the